Hello, Beatrice.
Hello, how are you? Where are you?
I am here.
I'm here.
Can you see me?
I turned off on my camera. I've
I
got
can
three
see
screens.
you. Yeah, where did you pop up? I don't even know where you are.
Can be a bit
Uh,
embarrassing sometimes.
yes.
My video. And sometimes I'm tutoring as well for VU.
Oh, yeah.
And when I'm trying to share my screen to explain what I'm doing, I've got three screens. It can be
Yeah.
very interesting.
Yeah. You click something and then it sends the zoom into the background behind other things, and you're like, where did my window go?
Yeah. And what am I sharing? That's the problem. What am I sharing?
Yeah. Am I sharing the right thing?
Is that the right tab that I'm sharing? Yep.
Yes.
How are you?
I'm good. I'm doing very good. So it's been a long day for me today with work stuff. So I feel like I haven't gotten away from my computer.
Um,
One of those days. But
yeah.
yes, my family, I can hear them out there watching a movie, and it's
Oh,
like,
really?
oh man.
How old are they? They're young?
I've got two kids, and so one's almost 14 and the other one's 11.
Um,
So I think they're watching one of the Marvel movies or
yeah,
something. It's actiony, but
yeah.
it'll be,
Boys.
yeah.
Oh, good. Good, good.
But that's all right. I'm looking forward to going through the stuff today, and we'll just see if anyone else does want to pop in and join us.
Yeah.
But I'll just get the slide shared in the meantime. Do 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 do. Share. All right, let's share that one. Okay. So basically what we'll go through today, kind of as we progress through the office hours, we start to explore more of the different stages of what's involved in the process of conducting research. And so we're going to start thinking about, you know, original empirical research with things we covered today, not literature reviews where we're compiling other people's research together, but for those who are actually embarking on studies and the process of collection and analysis and the different steps that are involved. And it wasn't until I did my own PhD that I realized like just how many steps are involved. It's not as easy as just going, oh, I'll just give this survey to 100 people. There's so many things involved in the process to go from your concept and idea down to actually having results that have meaning that you're able to disseminate and convey to other people. And you don't know what you're doing. When you're doing a PhD, you kind of learn as you go. And then, of course, we'll go through assessment two in more detail this week. How have you been going with your literature searching?
Yeah, good. The it took. I'm very glad that I did that in unit 2 or 3 because I knew machine
Yeah,
bullying, well, whatever. Yeah,
Boolean operators.
yeah.
Yeah.
What got me is the the diagram. So I had a crack at it,
Yep.
and and my numbers, of course, you have to be super good in math. My numbers didn't match.
Yep.
So I went many times. She's exceptional, this lady. She was really, really good. And
Yes.
she experienced, no, the count doesn't
Doesn't
match.
add up.
So which what you can. And yeah, but I think my my issue was I found a lot of reviews. So I had to
Yeah.
move them. I think
Yeah.
90% of what I read, I don't know how many, 90% were reviews, so I have to eliminate lots.
Yeah. But you might still find some good studies
Mm.
that the reviews were discussing because they've obviously pulled together other people's research to put together their review. So you might still, it'd be worth checking the reference lists of which studies they have used. And sometimes reviews, if you find one from like 2017, then all the studies they might be reviewing are older than that, 2014s and 13s, and you go, nah, that's a bit too old for me, whatever. So you kind of still do want to make sure that if you use some studies out of their own reference lists that are relevant to your question, that they're not too old, depending on what the age of the review is itself. But you can still keep the reviews to form part of your discussion in like your background and, you know, the context and some of the things in the discussion itself when you get up to assessment 3. So I wouldn't like just get rid of them altogether, but just save them, you know, in a folder so you've got some good other articles, other supporting literature that you can draw on, you know, outside of your actual articles that you'll be synthesizing. So, yes.
Thank you.
So we've gotten a few more people that have joined. Welcome, everybody. It's nice to see you all here. So we've got quite a bit of things that we're going to go through today, looking at the next sort of stage of the research process with how collection and analysis happens, which is the bulk of what you're doing with your own research and with study. And we're going to be thinking about not reviews, because you're not really collecting new data with a review. We're going to be thinking about research studies. So the sort of articles that you're finding to include in your reviews, you know, quantitative and qualitative different methodologies. And we're going to think about the steps that are involved in that process, which is likely more complex than you realize. And at the end, we're going to go through assessment 2 in detail. So for anyone who was here last week, we pretty much just covered all sorts of stuff about how to search the literature and search the databases, and lots of tips and tricks in there. And that was the main thing I really just wanted you guys focusing on for this first week of working on assessment 2, before I overloaded you with all of the things like, here's what you need to do when you pull your assessment 2 together. And today we'll go through the rest of everything. And so it's really clear what you'll be expected to do in that assessment as a whole. As I always do at the beginning, we'll do an every brilliant thing. If anyone's got anything nice they want to share from the previous week. So mine, I feel like every week I just have an update with this house thing. Because it's just like the highlight of my week. And yesterday we signed our contracts and paid our deposit, and I was expecting to see on like, you know, realestate.com.au, I was expecting to see it finally say like under offer or under contract, but they just fully marked it as sold, you know, even though we still got to wait for our settlement period. So I was like, it just makes it feel so much more like, yeah, it's ours. It's like not even visible to people anymore. It disappears when it's marked as sold, whereas it doesn't when it's marked as under contract. So we just got to wait it out now. But that's, you know, it's a good stage to be in. All the stress is gone. You just got to wait. So yes, who else has something nice they would like to share? You got something, Beatrice? See you unmuted.
I was waiting for Ina to say something.
Oh, hello, my name's Ina. One of my friends managed to pass the JAM exam, so that was really something nice.
Oh, yeah.
So yeah,
Yeah, well, that's very exciting, especially for your friend.
happy for her. So yeah,
Yes, that's a very good one.
thank
And
you.
do you have one too, Beatrice?
Oh, just something a bit silly. I managed to do my French recipe today that I've tried for many months. So I've succeeded in
Aha,
my French recipe. That's all. It's
excellent.
nice.
No, that counts. This is the sort of stuff I like here, and I don't care what it is, you know. If it makes you happy, it makes you feel
Yep,
good, it's
that's right.
worth it. So, yes. All right. Well, save up anything you might have for next week if you want to share. I'll try to have something non-house related next week. I'll try to be a bit more. Now that we're in the waiting period, I'll find some other things that make me happy. Okay, so today's session, in terms of content, when we're looking at the data collection and analysis, we're going to be working our way through these 5 stages of data collection and analysis. And I've actually kind of presented them on this slide here through like a little bit of a flow chart. And as we go, we're going to just run through each section, and I'll keep kind of circling them so you know where we're up to, before we even reach the stage at the end where we can actually start writing up our findings. And so there's lots and lots of steps involved with this. The first thing, though, at the commencement of any sort of research project is figuring out the types of sources of data that are going to be used. And obviously, an original research study is going to be using primary sources of data. They are going to be collecting that data themselves. So it's a direct gathering of information that's original and it's being collected for the very first time, whereas secondary sources are things that are currently published. So things you might find in your library or on government websites or in books or blogs or through the newspaper, and that sort of stuff. All right. Now, primary data usually gets sorted into 3 different categories. So you've got your surveys, which is collecting your data through interviews of people. They might use direct, face-to-face interviews, or ones that now can be done over Zoom. Those would still count as face-to-face, where you're actually one-on-one or in a small group asking people questions, or for that one's the most time-consuming method, despite it being the most personal. You can also take, surveys over the telephone. I can't even tell you how many times, when you ring up some of those businesses and they're like, please hold the line when we finish our call so you can leave some feedback about how our service was today. Like even that still counts as, a telephone survey. And then there's, of course, mail surveys. And so you might get things in the mail from like the government or other organizations or things like that. It might not be some like small researcher study. It could be statewide health data or information. And that can be a less expensive and time-consuming way than trying to organize interviews one-on-one with people in booking spaces and all that sort of stuff. So national surveys use that, kind of method a lot. We've got observation. So that's exactly as it sounds, where you're watching the actions of somebody or something, and they can either be personal, where you're directly watching like someone's performance or how they interact within a certain environment, or they can be mechanical. So, through videos and CCTV cameras, or even scanning and, and digital ways of observing how things are happening in an environment. And then our experimental. So lots of research is experimental, particularly in the health fields, either conducted in laboratories, where you might, for example, be trying to develop a new drug for clinical practice, or in the field where you then, for example, might need to test that new drug out in a clinical trial on real people, in a field experiment. All right, so we've kind of sorted all of that. And the first thing that you're going to end up gathering when you start to collect data is what we call raw data. All right, this is data that is not yet processed for use. So if I wanted to gather all of the grades for the students in a unit for one of the study periods, I can collect all that information, but it doesn't have any value when I haven't done anything to it. I haven't analyzed it. There's nothing that's been performed on it. All I've done is just gather everybody's grade outcomes. But what am I going to do with that information? And so this is the gathering of the information is not the hard part. It's sorting through it and refining it when we get up to that next step. So we need to think about the types of data with qualitative and quantitative and how those might get organized when we've collected them in their raw form. And if we don't know how to categorize these things, it makes it really hard for us to refine the data. Now, for anyone who might embark on a project that uses qualitative data collection methods, obviously qualitative data isn't something that can be measured or counted in the form of numbers. All right, this type of data is sorted by category or theme, not by number, and it's telling about the perceptions or the experiences of people, helping to understand their wants, their needs, their preferences, their experiences, and all that sort of stuff. Quantitative data, while more absolute and objective, requires, accuracy in how we are going to project that information to make it easier to analyze. So there's 2 main categories that we can kind of class quantitative data as falling into when we go to document down the numbers. And so we've got nominal data, and you might have heard some of these terms before. You would have seen data presented in these ways in literature and not realize that that's what you're looking at. But there's names for all of the ways that we present information. So nominal data is often used for demographic information. All right, so it's where we label a particular variable, not based on any sort of quantitative value, but just to distinguish between a different feature. So for example, you might label all participants that were male with a 0 and all participants that were female with a 1. All right, you fall in one category or the other. You might be married or non-married, or it could even be like your country of birth. Okay, you can't have more than one country of birth. Data can only fall into one category, and it's just a way of organizing your data set, and it's usually used on patient demographics or participant demographics. Ordinal data is quite similar. Again, it will only fall within one category, but in this structure, you actually want to have some sort of a hierarchy or levels where things can be ranked. So for example, you might rank education level, all right? And someone's got to tick their highest level of education. So there's a bit of a hierarchy as you move up, your primary school, secondary, tertiary, or even like postgraduate tertiary, and so you kind of are moving up the ranks. You again will only pick one option, but there's an actual order and structure with how it's being presented. It could also be used for the Likert scales, where you're asked to rank something out of 1 to 5, like patient satisfaction or staff happiness with their job, mental well-being, your pain, a pain score. All that sort of stuff is collecting ordinal data. Your pain is 6 out of 10, but there's an actual meaning behind the numbers, all right? Because 1 means it's lower and 10 means it's higher. So yeah, you still only fall into one category, but the category actually has a